a very important topic, which is observational studies, the quantitative aspect of it. If you must read research work and make use of research work, you must understand statistics and the principles behind it. Because if you do not have a basic understanding of how data is analyzed, then you can't really read and understand what is done in any paper you read. And therefore, it's important that we get the key message from today's lecture so that we can apply it both in our research work as well as when we are reading papers, we have a good understanding of what is done. And we have an amazing lecturer today to take us on this. I mean, I've attended lectures, Harvard, and different classes. But I mean, the lecture taken by Dr. Taiwo is always broken down into the basic principles so that everyone participating will grasp the knowledge that is required. We are happy to have Dr. Taiwo give us this lecture, and I'm sure at the end of this lecture, you understand what I mean by his proficiency in teaching. Thank you very much, sir, for being here for us.
Well, just before Dr. Taiwo starts, just a very brief profile about Dr.
Okay.
Taiwo and the reason why we're thanking him. And Dr. Taiwo is the Chief Executive Officer or Director General, I otherwise might say it in the Ministry of Health, of the International Center of Oral Health, located in Jos. The International Center of Oral Health is one of the WHO centers around the world, including Africa. So he does not really have time, but one of the things you're going to see is that Dr. Taiwo loves statistics. He definitely loves that. And in the world of oral health, he's globally recognized in our field as nothing else but the statistician around oral health. It's indeed a pleasure to have you here again. And of course, I'm seated to learn. Thank you so much, sir. Joining Kudus, so thank you for being here. Over to you, sir.
Good morning, Ma. Good morning, Dr. Lawa. Good morning, everybody. Please, am I audible?
Yes, you are, sir.
Yes, you are, sir.
Beautiful, beautiful. I appreciate that opening remarks concerning me. I feel so small beside you. You are my mentor, Ma, so I'm so excited to be at least teaching, and I'm more even honored to have you sit to listen to me. I appreciate that. Dr. Lawa, thank you for everything. So thank you all for joining in. My name is Niyi Taiwo. I am excited to share with you some insights concerning research methodology. I will be taking us through observational studies in the next few minutes so that we can have some time at the end to comment, ask questions, and share our understanding. Let me start by defining research. It's something that I'm sure by now you know, but I always like starting from the scratch. And I love this particular definition that says research is a systematic investigation designed to discover and contribute to a body of generalizable knowledge. So you'll see that there are some words or phrases underlined in that definition, but the one that concerns us today is that word design, and that is where our observational study comes in. When we say design, we are talking about the plan of how you intend to execute your research question, the plan or the blueprint. And as an overall or an umbrella term, we have the approach we use to execute that plan. And those approaches can either be quantitative, qualitative, or a mixture of the two. And you understand what I'm talking about as we continue. So this is just a summary of the research methodology process, where you start from the research question or the thought that has been lingering in your mind. And then you go to a literature review to ascertain that what you have in mind, has not been answered before. And it continues like that: literature review, your research hypothesis, approach and designs, your sample size, how you do the sampling, the variables and measurements scale that you're using, the data collection, data analysis, and then you report, your finding. So what we are actually talking about this morning is on the approach or design, and we are picking just one of them. Okay, so the research approach is a framework for conducting a study. So it includes your beliefs, the values that guide you as the researcher, or the assumptions you have in mind. And the choice of that particular approach is dependent on the type of data you intend to collect, We are not talking about data and variables or measurement scale here, but definitely you have an idea, since we've been in the class for quite a while, that data are different. We have the quantitative data, we have the qualitative data. So the type of data that you intend to collect will actually determine the approach you will use for your study. There are three approaches. We have the quantitative, the qualitative, and the mixed method. For the quantitative approach, here as an investigator, you are trying to observe and measure. Please look at those two words. They are cardinal. In quantitative approach, you can measure, you can count, you can quantify whatever data you are trying to collect. You know, here you study the relationship between variables, different variables that you might have collected. And in quantitative approach, you can test hypotheses. You know, like you can, let me give an example. How many patients, you know, come to the clinic regularly? There you can count the number of patients that come to the clinic regularly. How many patients are observing their medications as at when due? You can count, you know, what is the temperature or average temperature of the number of patients in your clinic? You can measure it and then you can estimate, you can measure and count and find an average. You can quantify. So that's why we say quantitative approach, okay? But there are situations where the questions you have for your research is not something you can actually count or measure. For example, why are you not taking your medications regularly? You cannot say 3%, you cannot say 4 times. You know, you need to understand the reason behind. And if your question has to generate qualitative data, then you need a qualitative approach, you know, for your study. You know, and this came about when people were finding it difficult, you know, to explain human behaviors in measurable terms. Measurement tells us how often or how many people behave in certain ways, but does not answer the question how, why, or how, you know. But in the qualitative method, you collect and analyze narrative and visual data to understand whatever phenomenon of interest you are looking out for. You know, so in qualitative, you have visual data. In qualitative, you have narrative data. Research that attempts to increase our understanding of why things are the way they are in our world and why people act the way they do is qualitative. And what will determine the approach for your study, it's your research question. You know, if your research question is what is the prevalence of something, that's the measurement, you know, and definitely you need to go quantitative. But if your research question is why don't people come to clinic on time, that's something that you cannot measure. You need to understand the reason behind. That will have to require a qualitative, you know, approach. It also helps us to answer how opinions and attitudes are formed, how and why. That's qualitative. Now, there are situations where your research questions actually will bring about the need for a combination method, that's the mixed method, where you have a part of your study being quantitative, another part being qualitative. And it's just that it harnesses the strength of the two methods because, you know, it cannot be exhaustive. One method might not be exhaustive to answer your research questions. You know, some of the synonyms for the mixed method includes convergence approach, integrated, and combination research method. So that's just like a brief introduction. So in summary, our approach to research can be qualitative, it can be quantitative, or we can have a mixture of the two, the mixed method approach. So what concerns us now is the quantitative. I believe what we are doing might not necessarily be restricted to quantitative, but the part I'll be talking about this morning is the quantitative approach, you know, to research. And I told us earlier on that that one has to do with measurements, okay? In many ways, the design of a study is more important than the analysis. Look at the design of a study like a foundation. You know, if the foundation is very sound and then in the building process there is a mistake, you can correct it. But if the foundation is faulty and then you build an edifice, everything collapses because the foundation ab initio is faulty. When you have a badly designed study, you cannot retrieve it because from the inception, everything is messed up. But when you have a poorly analyzed study, you can reanalyze it because the design is still okay. You can reanalyze it and then you can salvage it. So that is just a summary on research design and why it is very important to understand the particular design that you will be using for your research questions. Now, in quantitative study designs, the best way, the simplest way to categorize quantitative study is regarding the presence or absence of an intervention. What do I mean? You are the researcher. You might just have a group of people and you are observing what they are doing and you are recording or measuring some variables from them. That one is a type of quantitative study. But if in one way, you as the researcher, you are like interfering in the normal course of events, you are intervening and you are trying to look at the response secondary to what you are doing on them, that one is an intervention, and that's another kind of quantitative study on its own. So there are two main categories for observational study. Okay, there are two main categories for quantitative studies. It can either be experimental or observational. Okay, when we say it's experimental, that means you as a researcher, you are doing something in your population, in your sample population or participants, and you are trying to look at the effect of what you are doing.
My area boys called him and said.
And for the other part, which is observational, you are just observing. Look at the word, observing. You are just observing and you are recording the effect of whatever it is you are trying to trace. So we have two, experimental and observational. Both of them are based on either the presence or absence of an intervention. So like I said earlier on, in experimental studies, they are also called intervention studies. They are also called trials, clinical trials. All of them are synonyms: intervention studies, experimental studies, trials. It's because you, the investigator, intentionally, you are altering one or more factors to study the effect of what you are altering. It can be a medication. You are giving medication to see the effect. It can be maybe like a teaching session. It can be anything, but you are doing something and then you intend to look at the effect of what you are doing. So we are not talking about experimental studies today. Look at the title of the presentation is observational. So we are restricting our time this morning to observational study. And I said here in observational studies that you are just studying people in natural exposures, in nature. You are just studying them. You are not doing anything on them rather than just collecting your data and moving on. You observe them and you record the characteristics of interest that is to you. It does not involve intervention. Observational studies does not involve intervention. Rather than to just observe, you can count, you can measure, you can analyze your result, and you are done. So the advantage here is that they are readily obtained, but they can be subject to bias, which is called systematic errors. Bias is another topic on its own, but let's just leave it at this level. But for observational studies, the cardinal thing I want you to take home with you is that there's no intervention from you, the researcher. Now, observational study also has two subgroups. There are those that are descriptive, and there are those that are analytical. The descriptive methods from the name, they are just describing whatever you are seeing, either by the time, by the place, by the person, by the nature, by whatever. It's just to describe what we are seeing. While the analytical method, you are trying to examine a kind of causal association, a relationship between maybe the variable or an exposure and an outcome. You are trying to look at the etiology. So in analytical studies, you are able to make some assumptions. You can test hypotheses, but in descriptive, you are just describing, depending on whatever variable you are looking out for. This is a small chart to just summarize the different types of observational studies. I said that it can be descriptive or analytical. Under the descriptive, there are three types. We have case study, otherwise also known as case report, as in singular. We have case series or case reports now in plural, and then we have cross-sectional study. This is a study that I'm sure many of us are conversant with. And then under the analytical type of observational studies, we have cohorts, case control, repeated cross-sectional. We have correlational studies, we have comparative studies, and we have ecological studies. I will go over it again. Under analytical, we have cohort studies, we have case control, repeated cross-sectional, correlational studies, comparative studies, ecological studies. We'll briefly just go to the different studies and look at their distinguishing features. And I'm sure you'll grab it once and for all. It's a very simple stuff. So let's start with the descriptive observational studies. I said there are three types. Number one is the case study. So I got the knowledge that we are APIN staff working in APIN. So The examples I'll be using will be HIV related so that you can easily grasp at them. Good enough, some years back, I did some studies on oral manifestations of HIV and AIDS. So I think I also have some idea of some of the things that we'll be discussing here. So in a case study, look at it, a case study is singular. It's an in-depth examination of a single individual or a small specific group. Single individual or a small specific group, often involving detailed information. That detailed information is a description that you are giving about their history, symptoms, treatment, and outcomes. The purpose is just to describe a unique case. So you can see the keyword here. The purpose is to describe a unique case. And from that case, you can generate hypotheses or illustrate unusual or rare conditions. So we have an example here, that's to report a patient with an uncommon disease, detailing their symptoms, diagnosis, treatment, and response to therapy. So I'm going to use this example of zidovudine. I know that zidovudine is being used to reduce the mother-to-child transmission of HIV. Okay, so we have patients that are regularly on zidovudine, that I'm talking of pregnant women. So let's assume in the clinic when they come for their medication, I don't know how often they come now. In the past, when I was doing some studies monthly, but let's assume that you have given zidovudine and the person is coming back for the next dose in a month's time, and you notice that the patient has grown like a feet taller as a side effect of that drug. That is something new. That is something not recorded as a part of the side effects of zidovudine for pregnant women. So it's something strange that you have observed as a doctor. What kind of a side effect is this, that somebody is growing taller? That is a case study. You will now report everything about that particular patient, maybe a 32-year-old lady, that was diagnosed as HIV positive, so and so, age and gender and what's it called, height and weight and everything. You just report everything from the case note and now start talking about the fact that after she started taking zidovudine in a month's time, she has added 1 feet in her height, and then you just explain. You don't know what might have caused it, but you are describing that case. That's just an example. The limitation of case study is that you cannot generalize it to a larger population due to the small sample size of the individuals you are working with. So a case study is just one case or a small group of people. So if we are to talk about like a small group of people, you realize that people coming to the clinic, especially from one small locality, let's say in Ikorodu, in Lagos, are coming to APIN in Lut for treatment. And you notice that there's a particular settlement in Ikorodu, maybe a Bute in Ikorodu, where anybody who comes from there for medication have a particular kind of behavior. That's something strange, that's something weird, and you just want to report that. You are not sure of what's causing that, but you are just reporting what you have observed. That one is a case study. When we come to case series, now you can see it's plural. It's a description of a collection of similar cases that might be involving a group of patients who share a particular condition or experience. And the purpose is to identify patterns, trends, or potential associations between exposures and outcome. So like I said earlier on, using zidovudine again as an example, you have maybe a cohort of pregnant women, let's say about 300 of them that are on zidovudine. And then after like 2 months, you notice that one of them, had added like 1 feet in her height. And that is strange. And after some time again, you noticed another person, so now out of the cohort of like 200 or 300, you have noticed like 2 or 3, and you are now trying to report that finding. That is a case series. That's a case series. However, it might not be that the 3 of them are in APIN Lagos. There's APIN in Jos. I think there's APIN in other parts of the country. Let's assume there are other people like other colleagues, like in Jos, somebody also reported that finding of zidovudine and increased height. That's the case report, and then if that person's case report and your own case report in Lagos is brought together, that's like 2 different cases, it also makes it a case series. You can have somebody in the South also, so you have just a particular kind of finding, and you are compiling the records of those findings. It makes it a case series. So look at the example, a report describing the characteristics of several patients with a new infectious disease, or it might be a new adverse reaction, it might be a new whatever it is that is coming up, including their symptoms, risk factors, and outcomes. That's when you are describing it. It's also limited in the sense that it does not establish what is causing the finding, because you don't have a control group. So like I was saying, maybe this particular one is Lagos, maybe this one is Rivers State, maybe this one is Jos, and maybe this one is somewhere in Abuja. And all of you are noticing that after taking medication, the pregnant women are increasing in height. You bring in all your your folders, and then you write what you have found out, describing the situation. That is the case series. So it's just a compilation of the chart notes of different cases, you know, it might be from the same center, it might be from different centers. You bring it together and then you publish it. You have your journal article from a case series. Now, for cross-sectional study, like I said, is a very common one. It's an observational study that analyzes data from a population at a single point in time. That's cardinal. Single point in time. You just go in there, you look at what's on ground, you try and ask the questions about your observation and your exposures, and then the outcomes, and then you are gone. It is also called a prevalence study. The purpose is to determine the prevalence of a disease or condition, and you identify the potential risk factors and assess the burden of disease in the population. Look at an example. A survey to assess the prevalence of HIV among adults in a specific city. So possibly you go to maybe let's say you go to Abuja, you have done your study, you have calculated the sample size, and you have a population, and you are checking them for HIV positivity. And as you are checking them, you are also taking their CD4 count, viral load, weight, and other relevant factors. Once you are done, you are gone. So you have just gone there to look at the prevalence of HIV, you know, and some other parameters. Once you are done, you are gone. So you have taken all that you need and you are gone. The limitation is because it is still a descriptive study. You cannot establish their cause and effect relationship due to lack of follow-up data. You cannot say that this is what is causing this. You know, when you go there and among the population that you are working on, you are asking them if they are drug addicts, if they are injection drug users, if they are having multiple sexual partners. You know, you are asking all the potential questions of how HIV can be transmitted, but you cannot establish that it is the injection drug use that has caused their HIV or their multiple sexual partners. You will require a separate approach to be able to answer that particular question. Okay, the strength of cross-sectional study is that it's easy to do, it's quick, you know, and it's useful for generating hypotheses that you can now test with other future planning design. So this is an example of a cross-sectional study. You have your population, so you just come in once, you take like a snapshot of what you are seeing at a point in time, and then you are gone. You go and analyze your data. Okay. I developed this table to describe, what do I mean, observational studies, and I hope it's going to grant us some kind of ease to grasp this concept. So I have some symbols here, E, O, arrows, and M. The E means the exposure, the predictor variable, or what you are trying to identify. The O is the outcome variable or the observation you are seeing. And we have three arrows here. One is facing backward, one is facing forward, and the other one has no direction. And then M is for matching of groups. I will explain, I will use these symbols to explain the different observational studies we have treated under the descriptive study. So for this class, our exposure is zidovudine, one of the nucleoside reverse transcriptase inhibitors that is used for treating HIV. Let's just use zidovudine. And there are different adverse effects here, maybe congenital malformations, insomnia, and unexplained growth of the patient, which I just used for the case study. So that's just like an example for this class. So look at this table here. On this side, we have the design, and this is the type. They are all descriptive, and on the category they are all observational studies. They are not experimental. This is the part I want you to pay more attention on, and that's the setting. It can be in the past, in the present, or in the future. So let's start with the case study. It's in the present. You are seeing a patient, you know, and what you are looking at here is just an observation. That's the O. And for the example of case study, we are talking about unexplained increase in height, you know. So you just describe it. It's something you are seeing now that has appeared before you. You describe it in detail. You describe the patient, you describe the medication, you describe everything, and you are done. Like I said, it is also known as a case report. For a case series, it's just a compilation of different case studies, you know, maybe from different locations or from the same center, but at different times, you compile them. That gives you a case series, and it's also known as case report. Here it is plural, okay? For the cross-sectional study, you just go into a setting. Remember, it is still in the present. Right there and then, you ask questions about whatever you want to ask, And then you ask questions about whatever might be a preceding observation, exposure. Let me give an example. Maybe you go to a setting or a population, maybe let's say secondary school, and then you are checking them for malaria parasites. And as you are checking them for malaria parasites, you are asking how many of them have or sleep under insecticide-treated nets. You are asking the two questions at the same time. So it doesn't mean that not sleeping under the mosquito net is causing malaria, and it doesn't mean vice versa also. But you are just asking questions, and then you go and analyze your data. So you cannot really bring out any causal relationship. And that is why it's also called a prevalence study. There's no direction in the line. You are not asking if it's the net that is causing malaria or if it's malaria that is predisposing to the use of nets. It's just asking questions about the variables of interest, and you are gathering it and you are gone. So this is a table that just summarizes the descriptive observational study. We quickly go to the analytical design, where you can have ability to check for relationships between either the exposures and the outcome. They are good for causal association. And I told us we have the cohort study, the case control, the repeated cross-sectional, correlational, comparative, and ecological. Let's talk about the cohort study. It's also an example of observational study. Like we said, for observational study, you, the investigator, you just take measurements, you do not intervene or interfere, okay? The aim of the study is to find out if there's any association or relationship between development of a disease and a particular etiological factor that the person is exposed to. They produce the best information about causation. Now, in case you are reading literatures, the other names for cohort studies are follow-up studies. You will also see them being named prospective study, concurrent study, or longitudinal studies. So they all mean the same. Cohort studies, longitudinal studies, follow-up study, prospective study, concurrent study, they all mean the same as cohort study. Generally, there are two types of cohort studies. The follow-up or the cohort may be done retrospectively, where the population at risk can be identified at some time in the past and traced forward, or prospectively, where the population is identified or assembled by the investigator now and followed up in time. And then the third type is a combination of the two, and I'm going to quickly explain that. So let me start with a prospective cohort study. So today is 1st of August. So possibly you want to start a study and you are starting today, and that is 2025, 1st of August 2025. You gather your patients and possibly, okay, let's use that same example of zidovudine, and let's check it with a congenital malformation, because that was one of the, what's it called? One of the side effects. The children might come out with congenital malformation. So you have, let's say, like you have 300 patients in your clinic who are pregnant and who are on different medications. It might be zidovudine, it might be maybe efavirenz, it might be nevirapine or whatever. So let's assume you have 300 patients and you are trying to check for the effect of zidovudine on congenital malformation. The 300 patients are pregnant, and then you are looking at how many of them are on zidovudine and how many of them are not on zidovudine. So possibly you have maybe 50 are on zidovudine, and then maybe 250 are not on zidovudine. They might be on any other medication. And your plan is to follow them up till they deliver. So remember, you are not the one that, as a researcher, you are not the one that is giving some zidovudine and giving some nevirapine. It is just you coming in and seeing that that is what they are taking. And then you are following them up till their delivery. And obviously, you need to match them. Match in the sense that you look at age, you look at their gestation period, you look at their parity, you look at many things so that you can compare those on zidovudine with those not on zidovudine. You also look at their environment, their socioeconomic status, so that they can be balanced. And you follow them up till they deliver. And then you are checking how many of them have children that has congenital malformation among those using zidovudine and among those using nevirapine. The prospective nature there is that you are starting today and you are going forward. That is what prospective means. You are starting today and you are going forward. Now, for the retrospective part of it is that you are starting today, or no, you are starting in the past and you are finishing your study, let's say today. How does that work? In APIN clinic, I know that they have records. Whenever those patients come, you are keeping records of all that is happening, their drug use, side effects, and on like that. So you are now going back into time. We are in 2025. So possibly you want to look at the last 5 years and look at how many people had been using zidovudine among pregnant women and how many people were not using zidovudine, maybe using any other one. And you want to look at the outcome on their children in the last 5 years. So you go to 2020, maybe 2020 January, you pick the folders in the records, you sit down, possibly pick like 500 folders of pregnant women. You look at how many of them are using zidovudine and how many were not using zidovudine. You also match them by virtue of their characteristics, and then you check their folders from that 2020 January down till maybe July. Last month was July. Down to July, you look at how many used zidovudine and what happened to their children, how many did not use zidovudine and what happened to their children, and you have finished your study by today. I hope you understand that analogy. Look at this example here. So like I said, for the prospective study, you are starting now as an investigator, and then you are following up. This one is something that you are following up for like 10 years. And then that if you are following up for 10 years, in 2035 rather, you stop your study, you are done. The other one is retrospective, where if it was a 10-year study, you go back in time, 10 years ago, and then you follow up the records, and then you finish your study now. This is 2025. That is the difference. So the cardinal thing with a retrospective cohort study, I'm going to repeat it, the cardinal thing with a retrospective cohort study is that you work with records. There's no way you can do a retrospective cohort study physically because you are not there. So you go back and work with case notes or folders. But in prospective, you can work with the people. I mean, it's a follow-up study. You are there with them and you are continuing with them. But in retrospective cohort study, please don't forget that you are working with records. And then you are looking at the records, following them up from the time you started in the past to the present day you intend to finish. Beautiful. And then we have the third type. So this is an example of what I just said. The prospective cohort study is also called concurrent. You start here, you follow up to the future. The non-concurrent or historical cohort or retrospective cohort, you are here, but you are starting from the past, like I explained earlier on, and you bring it to the present. The mixed design is a combination of the two. So like we said about maybe starting 5 years ago, 2020, you started 5 years ago, 2020, and then you continue from 2025 upward again. So it means that for those people you are working with, if you are still working with pregnant women, that means there might be young pregnant women that you want to look at, their births, different births that they have going forward. Apart from the one that you have picked from the records, you still want to see what will happen going forward, as they continue their medication. So you are starting from 2020 down to 2025, but you want to finish your study in 2030. So that's a mixed design. And that means that for that particular mixed design, the people you will be following up physically must have their they must have their records, that you can start with and then continue to the future with. Awesome. So like I said, you start with a group of people without a disease of interest. You divide them into two groups based on exposure into the risk or factor you are trying to check, and they should be similar. And that you do by matching, like I said earlier on, and our own disease of interest here is congenital malformation. So we are saying that those who are exposed here are those on zidovudine, pregnant women. Those who are not exposed are those not on zidovudine but other medications. You follow them up to the future till when they give birth. You look at those who have congenital malformation. Among those who are taking zidovudine, those who don't have in their children, and those who are not taking, you also check for congenital malformation and lack of congenital malformation. That's just a simple method for cohort. So this is a pictorial example. You as the investigator, you have your study sample, and you screen for healthy people. Healthy in the sense of the particular condition you have interest. Let me just use another example here to make it easy. Let's say we are looking at for like lung cancer, and you want to study people taking smoking and those who are not smoking for some time to be sure or to bring out an association between cigarette smoking and lung cancer. So the first thing is, once you have your study sample, you will first screen them out to look at those who already have lung cancer and bring them out, not as to bring a confounder into your study. So you screen them out, those who have existing disease. Then we have the healthy people that don't have lung cancer. And then you want to look at the effect of smoking. So you, what's it called? You put them into two groups, those who are smoking, yes, and those who are not smoking. You follow them up into the future, depending on the number of years you intend to. You look at those who have lung cancers and those who do not have lung cancers, among those who are smoking and among those who are not smoking. So it's something that goes to the future for a cohort study, a prospective study, a follow-up study, or a longitudinal study. For the same cohort study, for the retrospective part, the one that I spoke about earlier on, you are in the present as a researcher or an investigator. You are going back into time, you are going back, and then you are following up the records, of your sample. For those who have an exposure and those who do not have an exposure, you follow them up to the future, not to the future, to the present rather, and then you are from their records, you're able to pick the development or non-development of the outcome of interest. Retrospective cohort, I'm emphasizing, is based on records. Case control studies is another type of analytical observational study. Here, the cardinal difference here is that a case control is one in which persons with a condition of interest, which we call cases, are already identified. And suitable comparisons, that's the controls, are also identified, and the two groups are compared with prior exposure, with respect to prior exposure. So let me give us an example using that same zidovudine and congenital malformation. So congenital malformation is a particular kind of adverse effect that can appear or happen in those who are taking zidovudine. So this time around, you just go out and look for those congenital malformed children among women who were taking zidovudine. So you look at women who are taking zidovudine and you look at their children, those who have congenital, you have identified them, not as if you are trying to find out if it will happen. These ones you have identified. Now you look at their parents and you look at other women who have children taking zidovudine without malformations. Malformations in their children. The zidovudine is my own assumption. You just take the children because they are pregnant women, they were HIV patients, and then you were asking them in the past, were you taking zidovudine, when you were pregnant or not, yes or no? So you have two groups of people. Children who have malformation, whose parents were taking zidovudine, children without malformation, whose parents were not taking zidovudine, based on your assessment and your question. And then you analyze the effect of zidovudine in development of malformation. Maybe when I get to the picture, I will explain better. The control is for matching, for parents who were also HIV pregnant, HIV positive, and have children. They are the control, and you match them age-wise, parity-wise, socioeconomic status-wise, environmental-wise, everything that you think might have some possible effect in the outcome of the condition. It's advisable you use control from the same population. So you won't be doing the study in Lagos there and be looking for control in Plateau states. There might be other factors that can confound your findings. And the controls should be comparable to cases, possibly by age, by the number of children they have. They should have the potential to become cases. So you will not be using a control. You can't use a man. A man will not have children. A man will not take zidovudine for pregnancy. So you have to use somebody who must be able to also have similar outcome, not the people that have reached menopause and they are not going to have children, okay? Matching should be done for comparability, I've said that, and it's the process of selecting controls so that they are similar to cases. It's a technique to reduce potential confounding, I've said that, and because subjects are identified after the disease has developed, an inquiry, the investigators check for the prior exposure. This case control study is sometimes referred to as retrospective or backwards design. If it is a cohort study, it will be written as retrospective cohort. But if it is purely just retrospective study, that is a case control. I don't want you to get confused about that if you are reading literatures or manuscripts or articles. When you see a retrospective study standalone, it means a case study. But if it's a retrospective cohort, that's the second type of a cohort study. Another name for case control is backward study, because we are going back. We are going back. So that's an example here. You collect information from two groups about a possible exposure. It is usually from outcome to exposure. So look at this example of alopecia. Alopecia is hair loss. Maybe in a patient that is taking efavirenz, okay? You have just noticed that there are some HIV patients that are having hair loss, and then there are some HIV patients who are not having hair loss, and you are suspecting that maybe it's the medication they are using that is the problem. So you look for those who are having hair loss, if you're able to get like maybe 20 or 30, and then you look for matchings, you know, like we have said, you compare, you get a control group, age, gender, different factors to just make sure that they are similar. And you start asking them about prior use of efavirenz. When you were diagnosed as HIV positive, what medication were you given? And then you ask questions about that from those who have hair loss and those who do not have hair loss. Now, the good thing with case control studies, you can ask questions about many medications. You understand? Because, I mean, it's an opportunity. You ask questions about many medications to see if those who are using it and those who are not using it, to now look at if any particular medication has the influence of developing hair loss as part of its side effects. So like I said, you have identified the cases, those who have lost their hairs, and the controls, those who have not lost their hairs, and you have matched them. You are now asking them about the past. Were you taking efavirenz? Yes or no? Were you taking efavirenz? Yes or no among the controls? It's the same question you're asking the control and the cases, and then you collect your data ready for analysis. So what then is the difference between retrospective cohorts and case control? Because I expect that to be running in our mind. You know, I'm going to give you the answers here. In a retrospective cohort, we try to compare the risk of developing a disease to some already known exposure. So in a retrospective cohort, you still don't know that particular disease. You are trying to follow it from the exposure to see if the disease will develop, although it is still in records. It's not as if you have seen your records. We are just taking the records from the past and you are coming forward. Whereas in case control, we already know the outcome. So we are trying to know the possible exposure factors that brought about that outcome. So in retrospective cohort, both of them are starting now. Retrospective cohort, you are coming from the back. In retrospective cohort, you are coming from the back, you know, to the future, which is now, so to say. But in cohort, it's still now. You have picked already the outcomes, and you are asking about possible exposure. It's a fine line of difference, which I don't want us to miss. Another difference that in retrospective cohort, you identify the groups based on the exposure. In a case control, like I said earlier on, you identify the groups based on the outcome. Case control studies cannot estimate incidence because you are not following them up. They can just tell you about maybe the prevalence, as it were. But in retrospective cohort, you can calculate incidence because there's a time factor of follow-up in retrospective cohort studies. I want you to know that cross-sectional studies, that's the difference between case control and cross-sectional studies. Both exposures and outcome are examined or assessed at the same time for cross-sectional study. You are just coming to a particular group, you are checking for how many of them have hair loss, how many of them were taking whatever medication in the past. That is the cross-sectional study. But unlike case control, you first identify those who have the hair loss. That's the first thing you are doing. And then you start asking about what has happened in the past. These are small differences that can bring confusion if people are trying to pick a particular study line. You know, so that's the difference between cross-sectional and case control. Secondly, cross-sectional do not have a control. Case control has a control. That's the matching. And cross-sectionals are for determining prevalence, you know, of a health outcome, unlike case control, where you are able to guess an odds ratio of the relationship. So when we talk of repeated cross-sectional, it's another type of analytical studies. You know, so these are cross-sectional done at different times prospectively. So I will just use a very simple example, you know, of maybe patients on nevirapine, and you are trying to check for alopecia, that's the same hair loss. So maybe this month of August 2025, they are at the they are in the waiting room in the reception area, and then you check for alopecia, you take all the measurements you want, blah blah blah, and then you release them. These are your patients, they are your cohort. Maybe in the next 6 months, like January next year, because they are coming on a monthly basis, you check for the same alopecia, and the kind of medication they are taking. And then August that same year, 2026, you do the same thing. And then January 2027, you do the same thing. It's a cross-sectional study of a defined group, but you are just checking for a particular condition and you are checking it at random at a specific time into the future prospectively. So this is an example of what I'm saying. This is the first snapshot in August 2025. This is the second snapshot in January 2026. And then you can continue like that for many years, depending on what you are looking for. Eventually, you collect your data, you analyze. So it's prospective in nature, but it is cross-sectional. Why is it cross-sectional? Because the people that are here today might not be all the people that you have, January 2026. You might have new people coming in, and you still have to factor them in your study. And it continues like that. So it's not as if there are particular people you are following up. It's just a cross-section of a population that you are following up. So going back to that same, that same table that I said I developed to help and also understand these study designs, we still have our exposure, that's maybe the drug, and then our adverse effects, the direction of our arrows, and matching. So this is the table I developed for the analytical observational study. Remember our design, we have cohort, case control, repeated cross-sectional. For the type, they are all analytical studies and under the category of observational study. Now look at the cohort study. There are 3 types. Number 1 is the prospective, where you start in the present. You start in the present. I'm trying to get my marker, it's not working. Anyway, you start in the present with an exposure. You can see Y/N, that is they are either exposed or not exposed. The M there is that you match the 2 groups, and then you follow them up into the future. 1 minute. You start in the present, you match your groups, either for exposure absent, you follow them into the future for your outcome. You look at the second type of cohort study, the retrospective cohort. You can see where it's starting from. It's starting in the past with the same exposure, yes or no, matching them from your folders or your case notes, and you follow them up to the present where you end your study. That is the retrospective cohort. And then for the retrospective prospective cohort, which is the mixed method, you start in the past, through the present, and then you go to the future. So if you understand this chart, this table, that it makes it easier, And then for the case control, which is also referred to as a backward or retrospective study, it is in the present here, but look at the direction of the arrow, it's going backwards. You are asking about what is happening in the past. That's for the case control. And then you are still matching, your what's it called? You are matching your case with controls. Your O here is you are matching the cases with the controls that you have seen. And a repeated cross-sectional, you are starting in the present and you are taking, snapshots at random, not random, maybe defined time, going to the future gradually. That is the repeated cross-sectional. I will quickly go over it again, please, so that you can grasp it. For the prospective cohort, you are starting now, you are going to the future. For the retrospective cohort, you are starting in the past, you are coming to now. For the retrospective prospective cohort, you are starting in the past, you are going through now, even to the future. And then for the case control, it's actually you are starting now, but you are going back to the future to ask about presence or absence of an exposure. While repeated cross-sectional, if you look at the arrows there, it's not showing any direction. It's just a snapshot starting now and going to the future. So still talking about the analytical study, we'll just quickly look at the last 3, and they are very straightforward. Correlational studies is a type of research where a researcher seeks to understand the kind of relationship, association, correlation, between naturally occurring variables, one with the other. So here as a researcher, you are looking for the relationship between two variables, without controlling any one of them. For example, what is the correlation between CD4 counts of patients on efavirenz and their degree of insomnia? So possibly you have a way you want to measure insomnia as the number of hours it takes them to fall asleep. And then you are trying to check for their CD4 counts for patients who are on efavirenz. So now you are trying to look at the relationship between efavirenz and the degree of insomnia. That is a correlational study. That's correlational. You are just taking between two different variables in a population. Note that correlational study is not the same as comparative study, and that's where people mix it again. While correlational is a type of research design where a researcher seeks to understand the kind of relationship between naturally occurring variables, with another, comparative studies compare two groups in an attempt to draw a conclusion about them. As a researcher, you attempt to identify and analyze similarities and differences between groups. Look at the example. What is the relationship between the occurrence of anorexia among patients with HIV on NRTIs and those on NNRTIs in Lagos State? So you have two groups. There are some patients taking lamivudine, zidovudine, and then there are some patients taking efavirenz, nevirapine. And you want to look at, the occurrence of anorexia among those two groups. So you have two different groups that you are comparing. That is why it is called comparative. One group can be in Lagos, another one can be in Plateau State, another one can be abroad. As long as you are comparing two different groups for a particular outcome of interest, that is what we call comparative group. The last one here is ecological studies. And here there are epidemiological evaluations in which the unit of analysis is population or groups of people rather than individuals. To understand the relationship between outcome and exposure at the population level, that's ecological. So the population or group, they represent people with a shared characteristics such as ethnicity, geography, socioeconomic status, anything that you are looking at for, that forms the population. Look at this example. What is the relationship between the state's counterpart funding for APIN activities and patient outcomes in 4 states in Nigeria? What is the relationship between the counterpart funding, and the patient outcomes of HIV in 4 states in Nigeria? Often in ecological studies, the information about disease and exposure is abstracted from published statistics. That is one cardinal feature of ecological studies, and does not require expensive or time-consuming data collection. So for this example now, you just look at the amount of money that the state has been giving, and then you look at the outcomes, which will have been the reports of APIN centers in different parts of the states, and then you try and compare the amount of money given, the outcome of patients in the report, and you analyze your finding. The unique feature of ecological studies is that analysis is not based on data on individuals. I've said that. Note that association at population levels may not always reflect association at individual levels. So if a particular state is giving more money and it looks like if maybe that particular state, the patient outcome is better, it does not really follow. We call that ecological fallacy. When you incorrectly assume that an association at the population level is the same at individual level, it may not follow. It's an ecological fallacy. So lastly, looking at that same symbol, exposure, output, and outcome, and matching and direction of the study. For the analytical observational study, look at the correlational study. It's present. You are checking observation and exposure at the same time. Comparative study here, you can see that there are 2 of them. You are looking at a particular group A and a particular group B, and then you are trying to compare the findings between the 2 groups. Ecological study is more like an observational study, more like a cross-sectional study, but the only difference is that your unit of analysis is at population levels rather than individuals. Thank you for your time. I hope I have made a bit of sense. I'll be willing to take questions if there are.
Yeah, thank you very much. I've been taking notes and following the discussion all through, and I'm sure the participants have learned a lot from this presentation. Once again, thank you very much. So we'll take questions by raise of hands or on the chat box. I'm not sure. And please take note, Prof has been putting some highlights of the lecture on the chat box, so you can also copy from it as your part of your notes from this discussion. So I'm checking. I don't think there's any question on the chat box, and there is no hand raised. Okay.
Yeah, I think Dr. Tomari says it's a
I
wonderful
think
presentation. So it's
presentation. Yeah.
exciting. Yes. Let me ask a question. Okay, there's somebody's hands up. Yes. Over to you, sir. Dr. Kudus, over to you. There's somebody's hands
Okay.
up.
All right. Justin Wofe, please go ahead.
Okay, thank you so much, Dr. Kudus. Thank you so much, Dr. Taiwo. This
Thank
is a
you.
wonderful presentation. So my question is in the case series. I want to
Okay.
know if the case series, if for instance, because you said one of the disadvantages of case series is that the case is unknown, or maybe for this, let me say the disease is unknown. So I want to ask, in case, is it possible to also do in a known disease? For instance, I want to take maybe mpox among HIV patients.
Okay.
And then I'm looking at the cases that happens maybe in Ogun or Lagos, and then as well also gathering cases that happen Benue, Plateau, and then combining all the cases together. Is that possible?
Beautiful question. So what you have just explained to me now is a comparative study, not a case series. The cardinal thing about case series are things that are unknown, things that are new, novel, things that you have not seen before. You understand? And you are trying to tell us about a particular finding so that we can start saying that, what is happening now? You get the point. What you have just described that you want to do now about mpox is a comparative study because you already know the condition. We know about mpox. Everybody knows mpox now. So you are trying to compare finding in this particular part of town, of the country with another part of the country. But if in the mpox, you are seeing patients with mpox, and then possibly they are developing extra fingers, I mean, something weird, something strange, that is when it becomes a case report. And when you have many cases, it becomes a case series. So always put at the back of your mind that case report or case series are actually conditions that are strange, rare, weird, or weird. You know, that you are just trying to introduce to the academic world or community.
Thank you, sir.
Yeah.
Thank you,
Okay,
Prof.
Prof. Oh, there's another hand up.
There's another hand.
All right. Tena, go
We
ahead.
have 3 minutes. Yeah.
Thank you very much, everyone. Thank you very much, Doc, for the wonderful presentation. Mine is the retrospective study.
Okay.
Trying to look at the records. Can you start from behind in the past and then also end in the past? If you want to abstract data or records,
sure. Beautiful question. Sure. So you might want to look at your record, maybe like a 10-year study, and then you are starting in 2010 and stopping in 2020. It's still a retrospective cohort. So it doesn't have to end today, but as long as it does not go beyond today, it's still a retrospective study. And that's a retrospective cohort because you were following up from 2010, you were following up to 2020. Beautiful question, Doc. Beautiful question. Yeah, I like that. Yeah.
Thank you, Prof. I think you
Yes,
have
just
that
the
question.
last one. Usually, APIN group, they do a lot of implementation science. Where does this fall within the structure? Thank you. Over.
That will require me
Let's
understanding.
study. Yeah.
Understanding the kind of data they have.
Yes,
to
they
be
do a
able to
lot of
know.
implementation science. But I think, when I think about it and rephrase it in my head, even in the implementation science, they need to they need to use any of this design. Because even within implementation science, the implementation science is usually driven by theories around them that are looking at what it means to scale up. But the design within implementation science can be any of this.
It can be, but more,
yes,
it will more be like from analytical part of it, because implementation science, you need to test some of your activity. Yes, so it won't be descriptive; it will be analytical.
It will be analytical, but it can use any of this design analytical within that implementation science. Available. Exactly. Excellent way to round up. Over to you, Dr. Kudus. Yeah.
Yeah, thank you very much, Dr. Taiwo, for this great presentation. And I think It's a 1 hour well spent for all of us, and we're starting our Friday on a very good note. With that, we'll round up today's conversation. If you have any clarifying question, you can ask on the page. You can always pass it across to Dr. Taiwo to help clarify. And with this, we'll call it a day, and we'll meet again next week where we're taking another approach to research, doing research. Thank you very much, everyone. You have a
Thank you so
lovely
much.
weekend.
Mm.
Bye, everyone.